It's hard to grow old in America. There's no doubt about it.
I have an incurable blood cancer. It's called multiple myeloma. The 4 main cancer drugs they have me on right now carry a list price of $875,000 a year.
And you're alone. It is a cold, lonely experience.
At West Health, we're working together for one purpose: to change a healthcare system that no longer works for the American people, especially seniors.
We are working hard with our partners to accelerate this change because we can't wait given the healthcare crisis we are in.
Because of the remarkable generosity and unwavering leadership of Gary and Mary West, 2019 was a year of unprecedented achievement in advocating for change and innovating models of care. We set the stage for this remarkable year first by framing the issues facing a fragmented healthcare system, by quantifying the U.S. healthcare cost crisis, exposing it nationally, and advancing bold yet common sense solutions to address it.
It's important as you're advancing any policy or really any research to understand what matters to the American people and where are they feeling the most pain. That was something that came out of the work that we did with Gallup. We found some really alarming things. Perhaps most alarming, many Americans are going without health care simply because it's too expensive.
Because the findings were too overwhelming to ignore, the West Gallup survey not only gained traction in the national media, but it also served as the perfect foundation for a critical conversation with experts from around the world about our 3 common sense policy positions.
If you go to quality, you will get better care at lower prices.
In other countries, they give people estimates and they're accurate, and we deserve that real transparency.
So how come we can buy drugs for our veterans at lower prices and we can't do it for our seniors?
And a conference like this connects the dots between the policies we have that are failing and the harm that it's causing real Americans every single day.
But, as with every critical conversation, truth needs to be spoken plainly.
We have stakeholders, we have players that work together to maintain high prices. It's called a cartel.
And he said, Dan, the first thing you should know about pharmaceuticals, we all collude. It's the dirty secret.
Life and death is being exploited by both the healthcare cartel and the politicians. Somebody has to break the back of both of those cartels.
West has been advancing policies on a number of fronts.
And as a result of this work, politicians are taking notice and we are seeing change. Here in California, Governor Newsom took the long-awaited step of signing an executive order to create a master plan for aging.
It's time for a new master plan on aging in California.
Nationally, we are seeing real progress in our effort to combat the high cost of prescription drugs with policy initiatives moving through Congress.
We're seeing, for the first time, bold policies being introduced.
But until Medicare ultimately is able to negotiate drug prices, our foundation, alongside other visionary organizations, will be putting pharma on notice and advancing innovative solutions like Civica RX.
We are here in purpose and in bricks and mortar to do what's in the best interest of patients.
The mission of Civica is to make sure that essential generic medications are available and affordable to everyone.
Civica RX made bold promises at its launch 1 year ago, and it is delivering on each of those promises today. In only 12 months, Civica RX has truly disrupted the marketplace and demonstrated the purchasing power of health systems to drive positive change in service of patients. In fact, our first generic drug has been delivered to partner health systems. While we can be proud of the momentum created this year from these and other policy and advocacy wins, our work is not done. Our teams work together to hit major milestones with our second area of focus, innovating models of care.
West Health is unique in its attention to solid research on the one hand, papers that get published in leading academic journals, but not stopping there, going on to taking those ideas into actual implementation.
Once we have that initial knowledge and we know that certain care models produce better outcomes or are more suited for seniors, that is really where the work begins.
Established with a grant from our foundation, we launched the Gary and Mary West PACE program, one that will become the gold standard around which all PACE programs will be measured into the future.
The PACE model of care is very special because it's highly coordinated, high-touch level of care, with the heartbeat of it being the interdisciplinary team, whereas we look at the holistic view of the individual.
Everything we do in our care facilities must pass what we call the MOM test. The MOM test is our North Star and guides us in everything we do. We care for these people just like they were our own family.
It's all about caring for the patients, and that's the #1 goal, but how can you collect data and create a model that then could then be scalable?
Scalability is key to our mission. Our approach to leverage models of care broadly is already seeing amazing success with geriatric emergency departments like the Gary and Mary West Senior Emergency Care Unit at UC San Diego Health.
The Senior Emergency Care Unit has given us so much pleasure in taking care of folks in such a beautiful and specialized environment to care for them in.
And when I was walking down the hall and I read on the wall that there was a place focused on the needs of a senior citizen, I thought, oh my, this is really good. A good comforting feeling.
What I think is so exciting about having an emergency room dedicated to seniors, I think we're going to improve the quality of care provided to our seniors in the community. But one thing that we do in the University of California is we share our data for our local health systems to become accredited, and then across the University of California.
The work with UC San Diego Health has been instrumental in creating protocols and guidelines that will not only be expanded across the UC healthcare system, but throughout San Diego, as we have partnered with the county to ensure all emergency departments are GED accredited. And across the country, in our work with Dartmouth Hitchcock Medical Center, we launched the nation's first geriatric emergency department focused on a rural senior population for the nation's 3 grayest states.
Of course, there's an opportunity to take this work and extend it. So this year we launched the Gary and Mary West Senior Emergency Care Network. It's a network of hospitals and ERs. They're going to share data to provide access to as many seniors as possible.
So working off the template of the Gary and Mary West Senior Emergency Care Unit, the American College of Emergency Physicians, in collaboration with West Health, has started the Accreditation for Geriatric Emergency Department program. And it's taken off like wildfire. Without West Health, that awareness wouldn't be possible.
And finally, we're continuing to expand access to oral health care for our seniors in San Diego County.
So 2019 has been an incredible year for us. We have had lots of good learnings. The major milestone has been to be able to provide high-quality service for seniors in need. And that's something that we're bringing into our newest location in San Marcos. I believe this model is paving the way for others to follow. That's creating an impact.
I don't know, one for Karen. I don't know who I would be. I like to thank Karen. Without them, I wouldn't have my teeth.
Whether it is a model of care or advocating for policy change, it is not only a privilege for us to do this work, but also an awesome responsibility. From next year and into the future, we will continue to fight to lower healthcare costs to enable successful aging for all.